want to do your intro first, or you want me to just go ahead?
Yes, right now, sir.
Go ahead. Mhm.
All right. Good morning, everyone. Yay!
Mhm.
Most of you may know me, but for some of you who do not, I'm Regina Favor, and I am mostly involved in the children's ministry. So you may think, why am I up here? Well, some of you may also know that I've had my son, my husband, and myself got COVID-19 last month. Our son Marcus had a very mild case, and so did my husband Rich. He had a 2 week battle with COVID in which he developed acute pneumonia. There were some scary times, but we had a doctor that helped us recover at home. I attributed my mild case of COVID to early treatment, which my husband did not receive until he was really symptomatic and feeling ill. I realized that we don't hear about early treatment that can save patients from being severely ill or being hospitalized. So I reached out to our doctor and I asked if he would consider doing a small talk about COVID prevention and early treatment um, here at our church. And obviously he said yes, so here we are. So our guest speaker is a board certified doctor of osteopathic medicine and functional medicine. He founded the Osteopathic Center in Winter Park, Florida in 2014, and he has successfully treated over 200 patients from COVID-19. It is my honor to introduce our speaker, Dr. Toe. Why Toe?
Thank you, everyone. Thank you, Regina. It's my honor to be here to talk to everyone about early treatments and prevention on COVID, which is, you guys would probably know, you cannot find this information easily in the internet. There are still a couple websites they talk about Western medicine way of treating the COVID condition. So let me kind of go back to do a little introductions on the key elements on understanding COVID, the key elements understanding the signs when you need to get help. Last part of it is the treatment part, and I'll go through some of the data really quickly on it. So my slide number two, my backgrounds, just Regina said it really well. That's kind of what I do. You guys can read afterwards. I pretty much do everything. My themes are really just trying to find a solution for everyone who are actually not able to get it from your conventional doctor. So let's do a little summary on COVID here. Um, we're going to go over that first page there, right there. Thank you. So, well, because we live in Florida, I was trying to present it in a way, trying to give you more Florida data. You can see in the curve, the red line and the plot was showing you, over the course of the starting of the COVID, and I mean, data back when we have a data tracings, and back in March 2020, this is the United States and Florida data. We've gone through three peaks. The last one in between July and September, it's really one of the most, strong one. You can see the number of cases, particularly Florida, out of the 50 states in the United States, we are one of the most, I would say, it's having the highest number of infection rate. And these are cases reported based on the health department data on that. And probably heard about alpha, beta, and delta. It's kind of what this is showing. We're showing more increasings in infection rate, and when we hit the delta back in the last peak, right there. And also something that is the nationally in the United States and worldwide, and the vaccination program has been launched for quite some time. There are a significant amount of people get vaccinated. There are also a significant number of people have concern about vaccines. Is it going to work or not? So the third wave is showing us there, the more vaccine program we do, it's likely there's a more genetic variation from the virus and causing more problems, and both on mortality and sickness in the body there, which is the bottom three curve and showing you it's the last wave is one of the strongest. So hypothesis saying that the more vaccine you do, the more likely we can protect people. Sure, that's a hypothesis. And but I think what we're seeing is there are actually a more reactive response in the community for a number of positive cases and death on that part here. So that's something to kind of think about when you look at the data. Another page just to show you in Florida, which is one of the worst states in terms of infections in the United States. You can see up to this point, the data was up to date until October 13th, on Wednesday. There are 59% of all age people are vaccinated fully in 2 doses or 1 dose with the Johnson and Johnson, the 2 doses for Moderna and Pfizer, and then the teenager are catching up on the vaccination rate. And then just overall, going to give you 85%. In the United States, the government are advocating getting a magic number of 75 based on CDC and NIH. They believe that we can get more protection on 75%. That's number crunching. Again, let me give you a little story I share. When I was actually working in the urgent care, which I still do about 2 to 3 days out of a month, and really just to help out some of the doctor in the community and do that while I do 99% of my own practice. What I found when the COVID on the Delta variant hit, I found that there was a significant number of infections coming in. That's understandable. But what I also found that there was a lot of people, I would say about 50% of the positive cases, they are vaccinated people. And the number that we were seeing in the country, in the United States, is not reflecting that, which I will show you in another slide. So that is raise a question about how does the government collect the data and how do they present it? That become very important for most people who understand, is the program working, not working? And we're going to touch a little bit on that. We'll go back to the slide. And then we'll go into the next page. That's telling the very significant components on telling you how the virus is doing on our body. And there were 3 curves there. There were the red, the green, and the purple. And the key is people, when we understand COVID, is starting from a coronavirus. So it does attack your upper respiratory and the lower respiratory components. The oxygenations become very important in the blood when our body, particularly the lung and the heart, are desaturating or decompensating both. Will oxygenation in the blood drop down? People gonna be in a respiratory distress. That's how make people sick, and that's when people will go to the hospital for that. I would talk about also there's a pros and cons by doing that, and then also you see that the first 12 days where everything happened, and your viral replications on the green curve, basically peak about 4 to 5 days. And then your inflammatory response is actually going a lot significantly ticking off after about 2 weeks on that. So most people don't even have symptoms for the first 7 to 10 days. So we call these incubation period. They said about 5. I say more about 10. That's what I've seen on the field. And then our body will either have a strong immune system, can handle it, or cannot handle it on that part. So, and then things go wrong when the oxygenation in the blood going to go down significantly and body needs more attention help. So our target as a group is trying to get prevention done before it start and once during it start in the first phase, which is the first 2 weeks when you got a COVID, either a positive test or a symptom that you suspect is COVID. And then the general rule is really important is the time is really important. When you have indications that COVIDs are hit to you, the earlier you get treatment, the better the result. That's really the key. So that's the take home from this slide here. We'll go down to the next slide. That's going to give you an idea about what exactly the different phases are doing and what are the symptoms you'll be feeling on it. So we're trying to stay on the first 2 weeks, before 14 days. on that and trying to kick in to have treatments on it. And the yellow part, we can actually see that too. These are the current outpatients. When we say outpatient, means off the hospital systems treatments. That's done by some of the doctor who believe there's a value for it, like steroid, anticoagulant if you think you have a high risk of blood clot, antiparasitic or antiviral, in this case called Ivermectin. And then monoclonal antibody is a treatment provided in the United States. You airdrop some antibody trying to help you to get the immune system stronger, and so forth. Okay, so that's kind of layout. I want to go in detail after that and this slide here, but kind of show you we need to get these virus under control the inflammation. Now go to the next slide. I want to spend about 3 slides to talk about the virus itself. It's really important. So this is kind of the photography on or pictorial representations on the virus with the best knowledge that we have. And it basically has some receptor, has a core, has a membrane. That's pretty much all about it. Down there are just letting you know the genetic codon that actually have a signature for every part of the virus. So when we design a test, like the nose swab or the blood test, they want to look for these kind of the DNA signature or RNA in this case, the nucleic acid, so they can have to see whether you have an antibody or an antigens. Now go down to the next page. This is a very interesting picture. This it's proposed mechanism on how the virus got into your body, and it's kind of important. So the virus itself is they want to get a copy machines from the environment, which is in that case is humans. Okay, and the blue or the green blue are human cell. The red is the virus. The virus needs a receptor to tag on, which is what they call ACE2. They tag it on, they find the label, and then they open the key with the little co-receptor, the little strict line there, the TMPRSS. The key open, virus goes in, it will be capsulated with the human cell membrane, and then go in eventually to the core where they find a piece of DNA, either a nucleus or in a mitochondria. They replicate it, and then they take the packaging material from our human cell and come out. And that, of course, they're going to multiply to from 1 to 1,000 to tens of thousands as well. That's kind of the process. So the virus take advantage of our body components to make a copy and also destroy the piece of DNA inside the copy machines, which is the nucleus and the mitochondria. So that's kind of the take home I want you to know on that one. So why do I talk about the nucleus and the mitochondria? Well, if the virus goes into the nucleus, the cell will die, and then the organ will fail. If we have the virus attack the mitochondria, which is a small organs within a cell, that's responsible to produce a lot of a product called glutathione. It's a detox agent, an antioxidant. It also lie within the organ. The mitochondria will produce your vitality of energy. So people will get fatigue when they got COVID. That's one of the most common symptoms on that. And the next slide will show you just an idea about what are the symptoms of frequently complained. I mean, I would say top 3 is really fatigue, fever, and cough. Those are the most common when you got a COVID-19 infections there. Well, you would say there's a lot of other infections do that too as well. How would I know is COVID or not? Well, one thing that I learned recently is this. Most people will complain about, phantom symptoms. Early on, they complain about loss of taste and smell. That's actually the alpha and beta, the UK strand or the China strand. The Delta one, they have that little component on top. They also have a migraine headache. So if you have any of the 3 there, that's adding on the fatigues, cough, and the fever, that's like an index of suspicions about getting COVID there. And also as whatever you do over the counter trying to report it, you will never get these. You cannot shake them off, and that's really highly suspicious on that part. We'll go down to the next slide. I want to go use some facts about COVID. This is kind of I'm using some reference article from the United States, just telling you. So right now, the three grand statement they want to present to you. They want to advocate vaccine because they think that the vaccine works. But the first statement from CDC said that that's a very minimum breakthrough infection, meaning that people who are vaccinated, a small percentage of people are only getting infected or carry the virus. This is what they say, and that's not what I'm seeing. Just to tell you, so I raised a question on that. The data was collected in August, and I collect some data for my clinic that I work. I would say way more than 0.01% with the sampling that I have on that one. Two, they were reporting worldwide wise is the there was actually saying that the Delta are very contagious, and it's for even vaccinated people can pass on to other people as it's much stronger than the earlier strand. So the UK data presented there's also a very likelihood the vaccinated people can pass on. That's from UK. And then you guys can also look at an article, multiple sources from Israel, which is around the world. This is the number one country who actually very compliant on vaccines. It's 99.5% people are vaccinated, and they still have a breakthrough infection massively in a couple months ago, and they're still going through the wave at this moment. The last part, I just want to kind of give you an idea that what I think the vaccine is helping is really preventing people from getting to the ICU. As far as getting the infection and slowing down spread in infection, it's not the case at all. So my question I raise to all my patients in both clinic, my own clinic and the urgent care, I always ask a common sense. If you look at the data and the health department in the United States, if the vaccine program is working, why do we have more number of infection than before? And at the same time, the number of people who are vaccinated are increasing dramatically. So that two variable in the equation, you add them together, I question about how the vaccine is working for us. I mean, it's remains to be seen, but I personally think that's a big problem they need to fix. But they are pushing the vaccines as a solution for COVID, which is not a good idea at this point. And last part, I'm going to go over the important elements on prevention and treatments. As you recall, what I say is by understanding how the virus do in our body, they come in, take advantage of our body, use it as a copy machines, and then they destroy the whole home, and then they leave with lots of food with them. So they're basically like a parasite coming to us as a human body there, and which is not good. The way we do that is prevention. Number one, the primary and secondary preventions. I tell people always check the weather. When I say the weather, that means you check the data with your local source of information, which is the health department in the United States. If the trend is going up, we need to be more cautious of what we do. I mean, I still believe there are value for face covering, which is the mask, and social distance, and the airflow, which a lot of people forget about that. At least in Florida, a lot of the offices don't even have a window open at all. And home, there's not a lot of people open their window. It'll be a good idea to open the window, let some air in once in a while. I know it's hot outside, but at night you should open up some of the windows, let air in the exchange. That's a good idea there. So I recommend advocating doing that. Of course, your basics wellness, you gotta eat well, if the best you can, with a lot of the fruit and vegetables, exercise and sleep well. Do the best you can. And then there are 4 nutritional elements. It will be good for immune system support: vitamin C, vitamin D, zinc, and quercetins. And there's also herbal formula that you can pick one at the minimum, like echinacea, angel oregano. Those will be helpful just to do that. There are also other ways called homeopathy. You can also take some products that actually help on antiviral. This is just a prevention. As far as choosing what the best for you, um, you talk to your doctor or you can do your own research. I think all above are good stuff. The last part, a lot of people don't even do that, is the maintaining the upper airway cleanliness. I advocate a lot of people do like neti pot or nasal wash with saline water because it helps. It depends on what you do. If you do a lot of outdoor activity with the in-office environment, it will be good to do a wash when you come home, just like you're taking a shower as well. And then also when you get sick, always get a do some nebulizings with some peroxide and water or salines. That will be helpful. And then one more category I just want to highlight. These are the 4 items I highly recommend of everybody to keep at home on that. Besides all your regular remedy, you got to have a thermometer to know am I having I feel warm, am I having a fever or not. You got to have a pulse oximeter to look at what is my oxygens are, so that I need to get medical help or not. Well, the magic number is 95%. When your oxygenation is less than 95, you need to get some help. Between 95 to 100, it varies. You could have a sinus congestion. You could have a little cough from a cold that would bring it down to that. But less than 95, you got to talk to someone about that. And another one is really hot item lately in the United States. It's the oxygen concentrator. It would be good to get one at home in case something happens. If you put on oxygen support to your family member, you can actually recover a lot faster. And particularly at night, because everything goes wrong at night there. Your organ function work really harsh at night under normal circumstances. And I think the oxygen will be helpful, getting a machines there. Last part, we'll talk about the nebulizing machines. Basically, it's a respiratory treatment. Keep that at home. And then mucinex. It's really important. The virus does thicken the mucus a lot. And a lot of people, that's why they cannot breathe, because the body is responding from the viral infection. If you take mucinex, they were able to break everything out. And that really helped on that one. Well, now, last part I want to go down is the treatment part. Here's what I do. What I found is here. That's what's happening in the United States. A lot of the regular doctors are being told by the health department, we cannot practice any medicines beyond the standard of care. The standard of care defined as whatever medicine has run a trial and FDA approved, according to the diagnosis. And we know that the vaccine, even the vaccine takes 9 months to get a full approval from FDA. So that's what they focus on. They probably not interested doing an approval for anything with outpatient at this point, because that's not their priority. But what happened in the 9 months when people got sick, and what can they do? There was no solution provided from the government. So the doctor itself figured it out worldwide what works the best at this condition. And one of the medicines actually highly used in worldwide by doctor outpatient, not in the hospital. It's called Ivermectin. It's an anti-parasitic drugs. I have a very good success with this medication when we start early on. It lowers the viral load. People recover a lot faster. The other one is an antibiotics. When people get into a secondary infection, when the virus starts destroying with an exaggerated immune reaction to the organs, particularly the lung, and antibiotics will be helpful to initiate at that point. The steroid is also a good component when you start early on that. So those are the 3 I recommend to do, and that's for the active phase, for the first 14 days. Particularly ivermectin, if you know you have COVID, please start it right away if you have the access. It will help you tremendously on this. And then the other stuff will be the herbal and homeopathy we talk about and above. That will take care of the recovery process. So the first 3 components do take care of you not falling off the cliff. but then you need some recovery from the herbal and homeopathy. The next phase we talk about is called respiratory phase. Well, that means I'm getting really sick. And I take the ivermectin, I take the steroid, I take the antibiotics. I think I'm stable, but I'm not feeling well. Well, that point, probably your oxygenation is low and not low to the point that you need to be admitted to the hospital, maybe need to be admitted to the hospital. In either way, if you have access on oxygen support and fluid, that will be helpful on that part. Last not least is the, let's say everybody recover from um, COVID infection. There are zillions of symptoms that comes along with the infection that you don't fully recover from it. That we'll call these long haul syndromes. And I have concoctions and recommendations to do some herbal homeopathy trying to clear it. A lot of my people have very good success. They get everything back, like losing taste and smell, or the headache went away, and so forth on that. So those are important. So you kind of know acute and chronic. You got to do those two pieces together to get help out. That's kind of my comment. And the last part, I'm going to throw into questions, everybody.
All right. Hello. All right. Is Thank you, Dr. Toe, for
Sure.
very informative talk this morning. If any of you have any questions that you may want to ask him.
Good morning. My name's Etienne, and I'm a nurse. I just have a question about ivermectin because I know it's a anti-parasitic drug. What does it exactly do with the virus? And
Very good point. Good point. Okay, good.
and I've read somewhere that side effects, those that are using anticoagulants already, like the blood thinners, it has more side effects for people who already taken them.
Gotcha. Okay. Let's go back to the first question. It's excellent questions. It's being frequently asked. Um, in the world of the medicines, when we, particularly the medical professional, when we talk about drugs, we are looking mainly on the main mechanism. What does the medicine designed for? So ivermectin are designed for as has a mechanism to break the cell cycle on a parasite called antiparasitic. When we say parasite, what really means the big guys. They're not the virus there. However, if you are aware, there's a lot of off-label use on the regular medicines. And let me give you an example on that. For example, Mucinex. Let's go back to that. Well, Mucinex are used for cough and thin out the mucus, right? Well, in the fertility clinic, we tell people to take Mucinex twice a day, have improved the chances of getting pregnant. It's off-label use, so it's not like, well, are you going to prescribe Mucinex for me to get pregnant? And yes, please do that. So ivermectin is like this case. It does, because the mechanism of break the life or the cell cycle on a parasite. It works mostly on the big guys. But what we found out of the study in Netherlands and Germany and India, actually, and they found that ivermectin actually worked effectively on COVID by bringing down the viral load, which is the same mechanism, and blocking them from replication. So as far as the potency and efficacy of the products, it's still under study, but there are a lot of the doctors already using it based on that principle. So that's the question number one. So it's breaking the cell replication cell cycle on that. Two, anticoagulants. You're correct. I mean, most we reserve that for people who actually have history of cancer, history of cardiovascular disease. We use COT with high precautions because of the side effect profile. In fact, I only use twice out of my 200 people that I treated for. Those two need an extra anticoagulant help. A majority don't even need to do that at all on that one. Did I answer your questions?
Yes.
Okay, perfect.
Doctor, so I work in a skilled nursing facility, and of course, there's a vaccine mandate for our healthcare setting. So I'm just curious. I'm vaccinated, but I'm at risk of losing some key members of my team. What would qualify for a medical waiver for
Perfect.
unvaccination?
Yeah, good. There was a statement from NIH, and so Dr. Fauci saying very clear about that one. From a federal standpoint, they would not wanted to have medical exemption, but there are a few exception cases. People who has a prior history of vaccine components. If there's a documented reaction to vaccine components, that qualify for that exemptions. And we'll talk about even tetanus shots, flu shots, your shingle shot, and it was you have a documented reactions from a component standpoint, not just the vaccine. You can get that, and most docs, well, some of the doctors you have to go to specialists. They're willing to do that part because they need to be tested on that one to be streamlined. That's what the big policy is doing. But and then I add a little wrinkle on your question there. There are also among state enforcement on all that, and then the private enterprise. So what Biden administration is doing is advocating or corporation who get federal funding, that's including Medicaid, Medicare for the medical community, or the defense industry, they got federal money for it. They demand them, they have to do it, and then the vaccination exemptions comes into case by case. But there are also other entity who actually have more flexibility, and it varies on the state. In Texas and I would say Kentucky and Florida are actually fighting against that kind of mandate. So there's another story developing on that, and then we need to remain to be seen about that part. But as far as go back to your colleague who was not vaccinated, who doesn't want to get vaccinated, the only way we do is going to go back with the vaccine components reactions on that one. I have done actually in the last 2 weeks, I've done about 12 exemption evaluation with a lawyer together. And so far they're not giving us any hard time at all. And the way we do it is, of course, we find any history that help to prove there's a vaccine reaction. And two, we also wanted to convince the person, try to do a temporary exemption rather than permanent exemptions. And most employers are willing to accept that.
Thank you, doctor.
Sure. Mm-hmm.
Anyone else? Anyone else for question?
Hello again.
No problem. Yep.
I just have like just clarifications because some of the audiences they're not like medical. On because what we're seeing in the hospital setting, those who have been like the data that you presented, those who have been vaccinated versus the non-vaccinated going into ICU, a lot of the not really data that we've actually seen with people that go through ICU, got intubated with the Delta virus, it's like 100% of them were not vaccinated. Those who have been vaccinated had symptoms but survived not even going to ICU. So do you advocate people getting vaccinated versus not vaccinated? I know there's prevention, but what I have seen with ICU is a lot more younger population, and a lot of them, it was like, there was a time in ICU that 100% of our patients were non-vaccinated and intubated. So.
Great question. I want to touch that a little bit on three different flavor. Okay. The first flavor, the hospital number, majority of the number that extracted to the health department to look at the severity and the case. In fact, you remember one of my earlier slides when they say hospitalization, the hospital, right? Well, my question to everybody on the stage here is to ask, well, who wants to go to hospital? No one wants to go to the hospital. So when we get sick, we want to get a question. We will go to a clinic or even go to the drive-through to get a test data. Do I have COVID or not? Whether you have symptom or not, I wanted to know, right? People go into that. And what happened is those who got positive, whether they're vaccinated or unvaccinated, the key is the following. Not every clinic are sending their data correctly, including me. What I mean by that, that's not required to send the data, say the patient's vaccinated or unvaccinated. All they care is how many positive case or negative case. So that's a loophole there in the reporting system. That's the outpatient part. So what you're seeing is in the hospital is when the outpatient's office, we evaluate the people. I give you an example on a day that I worked when the Delta hit me in the clinic on the urgent care. We saw 80 people a day. We have 40 people actually diagnosed with COVID, and 20 of them out of the 40 are vaccinated people because we do ask in our clinic, we document on our chart. 20 of them is unvaccinated. You know, you're correct. The unvaccinated people are actually sicker, so we send them to the ER from there. So we at the outpatient already filter out the vaccinated people who have a mild symptom. They never go to the hospital. So what you're seeing in the hospital, either on the regular floor or a ICU, it's all the unvaccinated people going in. So that becomes reality that way because it's being filtered, but it's not being reported appropriately with the current reporting system on that. So the data, people, everybody would think, including you in the hospital, well, it's the fact that everybody comes in unvaccinated, they're sicker, and they need to go to ICU. All you said is truth, but no one talks about before the fact, what's going on. What I'm trying to advocate is this: there's likelihood that the breakthrough infection is more than 0.01%, what the government reported. What I'm also trying to elaborate is the following: during a big Delta wave coming in the past, the vaccinated people that's also from a study from Europe. The vaccinated people and unvaccinated people has equal probability of infecting other people. So because they have no symptom when they have vaccines, but they can still carry the viral load enough to carry people who are actually unvaccinated or vaccinated. So that's kind of the second wrinkle I want to add there. So the vaccinated people and unvaccinated people are having a very similar capability to carry the germs and to everybody when there was a pandemic. Don't get me wrong here, now it's safe because that's why I say you check the weather. When the numbers goes down, hey, this is not a big deal. I think we're all going to be safe. But when the weather goes up, telling you there's a lot of virus on the community there, I think both need to take precaution. I mean, you walk to Publix, you go to Target, even Costco, you probably notice half of the people not wearing masks at all. You ask those people if you ever have a brave to ask that, which I don't. I don't want to stereotype people, but there are people ask to me and said, "Are you vaccinated or not?" They will ask you that question because you're not wearing masks. On that, you remember those stories, right? But that's kind of the thing. We just don't know. We don't know what's going on there. Are you vaccinated or not? So that's the second part. The third part of it is the people actually go into the hospital. In my opinion, they're doing a high flow oxygens. They're doing a lot of intervention way too early. And remember the hypothesis on the thick mucus. The more air you push into the system to your respiratory, the chances are you're going to get sicker faster because you can't breathe. The mucus plug it there. So I think there are respiratory therapists with extremely helpful component in the hospital. They break the mucus by doing a percussion therapy. It's or percussion pajama for the little kids. Those are helpful, but they're not being done all the time. So that's another third component on it. But I'm trying to answer your question at a different angle.
Did that answer your question? Yes. Anybody else?
Hi, a friend of mine told me that there's a ivermectin that you could put in a nebulizer, so that way it can get directly to your lungs.
No, I think for my research, I would say this is not effective at all. Mm-hmm. Yeah. I strongly discourage that.
I have a nebulizer machine. So what kind of essential oil should I put in there?
Well, you got to be careful because the oil will eat the container. So make sure that your machines is able to compatible with the oil on that. So you also need to be pre-mixed in a beaker before you put them in and go for it. Otherwise, your nebulizer got destroyed. So be careful about that. The oil, as far as doing that one, you can do frankincense, lavender. Those are pretty good for upper and lower respiratory. And a more widely used is peroxide and iodine that you can nebulize to go in. The peroxide do help have anti-inflammatory. The myth saying that you can get oxygen from getting peroxide there, I don't think that was the case. But the peroxide do really help to sanitize the upper airway by going in deeper to the lung. And then the iodine do help.
And so what percentage should I put in my machine? I have a small nebulizer. So I was
Okay,
wondering
so
if I get sick, what can I put in there?
good questions.
Yeah.
So the over-the-counter peroxide, so I would use 3 ml as a base, 3 milliliter as the base. Or if you have an over-the-counter peroxide solution, all you need to do is about 3 drops. Okay, a drop or 3 drops is all you need, because you're atomizing everything. That's my recommended recipe. Essential oil, all you need is 1 drop on the 3 ml on that one. And then iodine is 1 drop.
Any more from the floor? Question? Okay. I do have a question from that was sent over. What if this is not what do we do if we call our primary doctor and this is not what they recommend as early treatment?
Good point. So the key become general education. It's like why we're doing presentation today, because there are facts and there are group that the doctor believe their value on ivermectin, and that the literature goes on a lot. If the primary disagree with it, at least I can say that for the United States, there are doctors you can find they're willing to prescribe. I just tell people, it's better to get 1 pack on hand. There's in my treatments on 200 people and other doctors that I talked to, there was no documented case we actually caused any issues on ivermectin taking on anywhere either weekly or 5 days on a dosing that we recommended on that. So I will shop around, see where you can find a doctor willing to prescribe, which there are a bunch of them. I'm doing that.
Thank you, Doc. Another question that came in. How many months can I have the booster after the second dose? And after the booster, does it last forever to have the protection?
Good question. Well, the only data we have is from the second dose on the Pfizer. That's why they got approved first there. It also respect to the type of the viruses. They try to include every strand that they're able to detect right now. So what the FDA data are showing, they are good for about 6 to 9 months for getting a 95% efficacy to stay 6 to 9 months. It depends on the individual. So therefore, when the Delta was hitting us a couple months ago, there was a big advocate and putting full gears on the third booster shot to try to cover as much as possible on that part. So 6 to 9 months is the answer so far.
Doctor, my name is Rick. I'm the pastor here, or lead pastor here. And I'm asking this question on behalf of my family from the Philippines.
Okay.
Do you recommend taking ivermectin as prophylaxis? And if what are the possible adverse effects of long-term use of the drugs?
Good questions. I personally don't advocate prophylaxis unless you live in the area of pandemic, which is completely out of control. So again, that's the third time I mentioned, always look at the weather. And if your neighborhood, your number is down, it's completely safe, there's no need to do that. I advocate for three type of people to do the prophylaxis. Number one is the people who actually travel frequently around the world and also in domestically within the country, because its chances of getting the COVID is very high, and so that would be good. The other one is when the pandemic hit, you have to travel, you have to do a lot of people contact. That become valuable. You only need to take it once a week on that part. The third people who actually is immunocompromised, whether you're vaccinated or not, you can take that. It's once a week. When the weather goes down, please take them out.
So, what are the risk of long-term adverse effect? Is there?
Good question. Liver damage. Ivermectin do metabolize in the liver. It's go through the second phase of the detoxification. So you can cause hepatitis. You can cause pancreatitis. So what I tell people to do, if you are the one for some reason, which I don't recommend, to do that weekly on a regular basis, a liver function and pancreatic function needs to be monitored monthly. And if there is a horizon, the medication has to be stopped.
Okay. Doc, another question. If you are sick with COVID, when should you go to the hospital?
Got you.
Yeah.
Okay. My magic numbers are oxygen saturations. When it's less than 90%, you want to think about hospital. When you're less than 95%, you think about seeing a doc, calling your family doctor or internal medicine doctor for help, or any kind of allied professional that help, even a nurse, respiratory therapist. Those are very smart people. They should be able to give you some guidance about that before you have to see doctor. So 95, 90 on that one. And plus two other things, uncontrolled fever and respiratory distress, meaning that, my number looks good at 90 or 95. I don't feel well. I can't breathe. Okay, that's the one I think we should get more attention on that. The last part is when we have a chronic cardiac and pulmonary disease. Yeah, like COPD, people are chronic smoker, undiagnosed COPD or chronic smoker, or people who has history of heart disease. They need to watch closely on that one.
Okay. Another one is, what is your recommendation on vaccine on teenagers and children? And what about what we hear in the news about myocarditis associated with the vaccine on young people?
Good questions. So the vaccines are designed in a way of weight base. The only difference on a junior version versus an adult version is the concentration of the mRNA components in there. It's probably about 1/3 of what the adult getting was given to the child. So they will actually go according to the weight base there. So as far as recommendation, it's probably similar to the adult because they calculate the risk factor by the weight. So it's all personal choice. It does help for preventing going to the ICU, but it did not prevent getting the infection. So that's kind of my answer I want to deliver.
Okay. And what about people who have had COVID and made it? What about natural immunity, and should they get vaccinated?
So the guideline currently recommend on getting people who got recently COVID infection, the antibody will last anywhere from 3 to 6 months. There are people outline that can last up to a year, but they all kind of wear out. So therefore, as you recall, one of our medical experts in the U.S., Dr. Fauci, finally said that in June there's no herd immunity because the antibody is not long lasting. So I would say for people who got recently infected with COVID, haven't been vaccinated, they probably have a good 90 days before they think about doing a vaccine. There's no rush for it. You've got full protection from the exposure because the antibody level is as good as a vaccine for the first 90 days. Beyond that, you're going to go down, and again, it's become a personal choice. Do you want to get vaccinated or not in that one?
Okay, thank you, Doc. Any other questions? Oh, one more.
Good morning, Dr. Tao. My question to you is kind of personal and medical. So, what do you think about the anti-vaxxers? It's just because there's a lot of things going on, and I have to look at the bad news and all that kind of stuff, and some of it's been politicized also, and then you have to sorry, and then you have to talk. I have to think about the spiritual aspect. Or no, this is a church, so
Mhm.
what do you what would you say about those people that say I really don't want to get it?
Mhm. Well, that's a very broad and great question. Again, I go into the third time. It's really personal choice with respect to three area. One is your belief system. The other, what you believe on, whether you want the vaccine or you don't want it. That's nothing to do with the COVID, your personal belief. Because, even before the COVID, there's a bunch of people, they don't even vaccinate for anything anyway, right? It's really their choice. It could be religious reason, it could be personal reasons, it could be family reasons. They don't want to do that, or personal experience. So they don't want to get vaccine on that one. That part's always there. Then what's adding to a more complicated stuff is when COVID hit, the product are fairly new on the market. The anxiety factors for most people who are intelligent will ask the question, is it going to work? What's it going to do in my body? There was no answer from the government at all, period, up to this point, because they don't know. Honestly, they just don't know. It's a one of a unprecedented human trial on a new product on the market, and people are doing it because it did help to slow down the infection in some respect, not on Delta for sure, but it did prevent a lot of the death. So that one, that's a fact. I'm not going to deny that on that part. The last part is become political. I agree with that. People will label that for the anti-vax or the unvaccinated people together. Although they are different things, but they lump those two together to be either you're a Republican or Democrat. I don't think we should do that. We're all American. We're all humans. There's no party involved labeled in the vaccine. We should not even think about doing that. In fact, I discourage to have that kind of behavior because we're all together in live in the country. Even all people in mankind are together. We just have to use our own judgment about is the product fitting you or not, based on what your prior belief on, and what action would you like to take at this moment to help the community or yourself by choosing vaccinated or unvaccinated. There are ways you can manage. I mean, they're high maintenance. If you don't vaccinate it, the high maintenance part will be, well, you know what? I'm going to wear a mask. I'm going to social distance. I'm going to be cautious. There are people who love to do that. They don't want to get vaccinated for religious reasons. I respect that. I mean, I'm not the doctor to tell them, hey, you have to get vaccinated because the health department say you have to do that. I think that's mean on that one. But I think we need to let the people to make the decisions on it, not a mandate. That's kind of a perspective. But I still admit that there's a value for the vaccine. There's also a lot of questions have not been answered by anyone because simply we just don't know. Does it make sense? Mm.
Another one?
Hi, doctor. I have a
Mhm.
question. How important is the booster shot, and are you gonna recommend it? Thank you.
Good question. And again, it all depends on what your lifestyles are. If you work on a high risk area, like in medical floor, high ICU nurse, and you're confronted with sick COVID patients, I think that's a value. You need that one here because we already know it wears out about 6 to 9 months. Your efficacy is less than 95%, so you can get hit easily on it. But I mean, I don't like to get COVID. I mean, but you're not going to be as sick as people who doesn't get vaccinated for it. So that's one group of category. As far as the elderly and the immunocompromised people, I don't think I disagree with the government. They said that they're advocating for the elderly and the immunocompromised people there. I think the third booster to make him more sicker from the data that I've seen so far. I have a little reservation, but in terms of 65 or lower normal people, I don't think we need it honestly on that one, because even the CDC come up with their counter offer to Biden's administration, discouraged to do the third vaccines. Part of it because they know there are potential reactions, more vigilance than the second shots. They're also looking at the data there too. You know what? We're still getting. They didn't say that, but I think on some article to kind of mention that there are Israel data and the UK data saying that the vaccinated people and vaccinated people, they have a lot of these carry a lot of viral load anyway. So there's no reason to give more chemical to the body. So they said they got to hold off. So my recommendation, 65 lower. If you got 2 shots, you're done. And only one needs to have it. It's probably the medical professional working in a hospital in a high risk setting. And then for people who are elderly and immunocompromised, if they were healthy and stable, I will hold off to the shots.
So, if you have ivermectin at home and you're getting the symptoms, you're not going to a doctor yet. Can I start giving myself dosage of ivermectin on my own?
If you know what the doses are, so again, it's based on the weight. Based on the weight base, that's a formula. I can email that to Regina, and then you guys can take a look at that one. If based on the weight, there was a milligram per day that you take. And so to answer the question, if you have the formula, you have it at home, please take it. Yeah, it's completely safe.
And Doc, maybe this would be the last question. For those people who have risk of losing their jobs without getting vaccinated, is there anything that we can do or they can do to kind of armor themselves if the only way they can keep their job is to get the vaccine?
Yeah, that's a very tricky question. It changes every day, the solution on that one here. I would say by all means, trying to get an exam. If you don't want to get the vaccine at all, and you are asked to do so, I will first ask for a company a form that you fill out for medical exemption. They need to offer you to that because that's democracy. You have to give it to you. Look at cautiously about what the medical exemption form will say, and then consult with a doctor or lawyer. See whether that's feasible that you can actually get that done, and do it cautiously. That's what I think we should do on that one. Remember the early on conversation also said that too. There was influx changing state by state about who against the mandate. That's also a heavy factor on that. So it varies. If I live in California or New York City, I mean, all my statements saying today is invalid. Does it make sense?
Yes.
Mm-hmm.
All right. Yes. Thank you, Doc. So, I'm sorry, Doc. One more. There's one more question. Last one.
Mm-hmm. Okay. Mm-hmm.
Sorry, Dr. Teo. One more question.
Sure.
There's the new thing now for kids that I guess it's available now. The vaccine is available now for kids. What do you think about that? And I mean, do they really need it? And especially for those like low risk kind of kids, because when COVID started, I decided to homeschool all of my kids, and I'm not planning to get them vaccinated. So, what do you think about this new vaccines now that they come up for kids?
Yeah, that's also part of the variable on the vaccinated versus should I vaccinate and not vaccinate questions. Well, remember what I said early on. We still don't have enough data to have a long-term study to say what the impact on multi-organ system on the human being, what's it going to do in 10 years, right? So that is like we're playing Monopoly here. But we don't know what we're going to win or we're going to lose, right? So that's a personal judgment about that. My recommendation is if you have the environment allow you have freedom, don't have to get vaccinated for it, that's probably the way to go to keep yourself more under control. That's what I recommend on that one. And things are changing daily and yearly. So I think that will be the best conservative solutions to do that. But if you get into the environment that your children has to get vaccinated because in order to go to a certain school and they really wanted to, it's become a personal choice. I have a lot of patients like going to transfer from no vaccines, but they have to go to NYU because it's their dream school. They want to do it. They got a full scholarship. He has to get vaccinated, and I have remedy to help them to before and after. So their management can be done to minimize the damage on a side effect, but the long term side effect we just don't know on that part. So again, it's back to the family decisions and the personal decisions about that.
All right. Thank you, Dr. Toe.
No problem.
Dr. Toe has a private practice in Winter Park. So if you ever want to see him, just ask me. I'll give his information. And I guess that's where we wrap up. Thank you, Dr. Toe.
Thanks, everyone. Good to be here. Mm-hmm.